This is Michael Wilson. Erica Moshtahedian, who writes for The Federalist, says she was prescribed a puberty blocker for cancer treatment. Quote, I can't fathom giving it to healthy kids, she says. So this July, she has been in remission from leukemia for 5 years now and is no longer a cancer patient. And yet her journey as a perma patient has only just begun. As a perma patient, she'll need several types of continued care for the rest of her life because of the treatments she's received. It was an unexpected trade-off that comes from surviving an aggressive form of leukemia, acute polyocytic leukemia, a type of AML. My father passed away suddenly from leukemia at the beautiful, wonderful age of 89. So on the evening she was diagnosed, she was told that without treatment, she might not survive the night and had to decide on the course treatment at once. So she looked at all the research and eventually came to the decision to take the pharmaceutical. She received Lupron her first day in the hospital as part of the care she needed. It was prescribed for two reasons. The first was because she had a hemorrhage type of leukemia, and Lupron was used to stop the risk of her period transforming into a hemorrhage. And the second reason was to protect fertility, operating under the theory that by temporarily shutting down fertility by inducing temporary menopause, the inactive system wouldn't be exposed to the chemotherapy agents that she was taking. The use of Lupron at the time to protect fertility was new and not one that the FDA had even approved. None of the chemotherapy agents she took caused hair loss, but she lost half her hair during treatment from Lupron and wore a wig for over 6 months after the treatment ended. So Lupron is also prescribed as a puberty blocker for children with gender dysphoria. Since she has taken it, her observation is she's just appalled that they're giving this to children. She can't fathom how using Lupron on otherwise healthy bodies, knowing its long-term side effects, isn't criminal. More appalling is that this strong pharmaceutical is used in children with a psychiatric condition that will be resolved in up to 90% of the children if left unmedicalized. This is akin to prescribing hysterectomies for hysteria in the 20th century. Lupron is used differently at different doses in cancer patients. When she took it, Lupron was prescribed for fertility preservation at 3.75 milligrams monthly. Prostate and breast cancer patients sometimes received it at twice the amount she did. Boston Children's Hospital has a document on using Lupron as a puberty blocker in their gender facility. The dosage they prescribe is 7.5 milligrams. It's twice the amount that she received. And it is used to create temporary menopause, and functionally the same amount is used to create permanent menopause in women with estrogen positive breast cancer. So she was 33 at the time. She knew the trade-offs that came with surviving cancer. Children, especially those actively experiencing mental illness, cannot possibly fathom permanence or provide informed consent like she did as an adult. And as someone who could have, permanently sacrificed motherhood for literal survival, she cannot fathom how the medical community could ask children or parents to make this decision for anything else. So, is it really a life-saving drug? In the case of childhood cancers, uh, treatment often includes understanding the horrendous trade-off of life for fertility, and parents are burdened with that final decision. But in the case of gender dysphoria, there's a conflation between suicidal ideation by a minor and a deadly acute illness such as cancer. It is also becoming apparent from numerous adolescent detransitioners who are coming forward now via lawsuits and social media that parents can't make the informed decisions either when these changes are inaccurately described as life saving. They are not life saving. And so, thus, we must ask ourselves as a society whether children or even their parents can consent to drugs and procedures that create permanent dependence on medical care absent life-threatening illnesses such as cancer or diabetes? Can they consent during periods of intense emotional distress? It's highly unlikely. The side effects of continued use of Lupron um, are very severe, and they are permanent. We can have a high degree of faith in science and medicine, but it's evident that we must prevent the medical exploitation of children and work to keep the temporary distress of adolescents from being permanently medicalized and pathologized. So the time for, well, let's just live and let live is over. States and even the federal government should continue intervening. We must stop the needless sterilization of children.